Up-to-date COVID-19 vaccinations could happen at intervals of 9 months or a year. The Health Ministry is also looking at stronger vaccination coverage for young children and soon toddlers. The Health Minister says these strategies are needed as herd immunity is unlikely to be achieved. Lisha Rodney reports.
Singapore cannot let its guard down, even as the current COVID-19 wave is projected to be on the decline. Health Minister Ong Ye Kung says people are reinfected with COVID-19 as protection from previous infection wanes.
While the current wave is subsiding, and I think the worst is over, it is important that we do not be complacent. As the protection of vaccines and prior infection wanes, the virus will circulate in our society again, and cases will rise. We must anticipate when that will happen and take the necessary precautions, including the most important of all, which is to keep our vaccinations up to date.
The Health Ministry estimates that 3 in 5 people in Singapore were infected with COVID-19, but that still doesn't give the country herd immunity as the virus mutates.
There are only 2 ways to minimize this. 1 is social restrictions. 2 is ensure good coverage of vaccination amongst the population. All of us do not want to bring back social restrictions as far as possible. The rule of 5, rule of 2, we try to avoid that. And so therefore, we need to rely on vaccinations.
The ministry's data shows that the protection with 3 doses of the mRNA vaccines remains strong in preventing serious illness among the elderly. For instance, those aged between 60 and 69 have 93% vaccine efficacy against severe disease 270 to 300 days after the first booster. This same group has a 90% vaccine efficacy against hospitalization. Currently, about 40,000 seniors above 60 have not completed the 2-dose vaccination. Another 40,000 have not received their booster shots.
All of them are vulnerable to severe illnesses if infected. And we will continue to try to reach out to them through our mobile vaccination teams, through our home vaccination teams.
Children aged 5 to 11 may soon get their booster shots. So far, those under 5 are not part of the nation's vaccination program yet. But they too could soon receive the shots later this year, as the Health Sciences Authority is currently reviewing the safety and effectiveness for this group.
Currently, children under the age of 5 remain more vulnerable to COVID-19 infection and have higher rates of severe outcomes as compared to older children. This is similar to other respiratory diseases.
HSA has also granted an interim approval for AstraZeneca's antiviral monoclonal antibody Evusheld. It is available for adults who are not eligible for COVID-19 vaccination.